Welcome to our comprehensive guide on the HealthTrackRx Genitourinary Menu. In this video, we'll explore the various panels available, the specific symptoms each is designed to address, and the pathogens they detect. Our goal is to provide you with a clear understanding of how these targeted tests can enhance patient care through precise and efficient diagnostics. HealthTrackRx syndromic genitourinary menus were designed in collaboration with infectious disease physicians to help providers only test for pathogens directly relevant to their patients' symptoms. This approach limits over-testing of microorganisms not pertinent to the patient presentation and ensures providers only detect and treat what is medically relevant in each patient's case. Our urinary tract infection menu tests for the most common bacterial and fungal pathogens implicated in UTIs. This is a great menu for patients with dysuria and frequency or urgency of urination. Because HealthTrackRx uses molecular testing, our tests are less prone to sample contamination thanks to our one universal collection device. Any organisms present during collection are killed when placed in the collection device, preventing growth in transit and ensuring an accurate reflection of the microbial load at time of collection. This means contamination is less likely to impact results. The urinary tract infection and high-risk sexual behavior panel includes both the common UTI pathogens and organisms that cause sexually transmitted infections. This menu is a great option for patients that have a differential diagnosis of both UTI and STI, as symptoms can sometimes be similar. This panel also includes pathogens that are associated with recurrent infections, making it perfect for patients with a history of urinary tract infections. The HealthTrackRx Urethritis Discharge menu covers the common causes of urethritis, such as sexually transmitted infections. This is helpful for patients that come in with concerns about burning with urination, penile discharge, and dysuria. This menu tends to be male-focused, but can be used for either males or females. The vaginitis menu covers all the common pathogens that can cause vaginal discharge, including bacterial vaginosis, candida, and sexually transmitted infections. This panel helps identify the cause of vaginal discharge when symptoms are nonspecific. There are multiple collection sites that are accepted for this menu, including vaginal and cervical collection, vulval or labial swab, or voided urine. If symptoms are predominantly associated with the genital tract, a cervicovaginal swab is preferred for the most accurate pathogen detection. For patients with recurrent or chronic vaginitis with standard symptoms, the recurrent vaginitis menu includes the pathogens on the base vaginitis panel, as well as mycoplasma and ureaplasma species, which can sometimes be associated with recurrence. The HealthTrackRx Genital Lesion menu offers testing for pathogens that cause genital ulcers and lesions. There are multiple specimen collection types that are accepted, but the most sensitive collection for this menu will be a swab of the lesion. Our pelvic inflammatory disease menu offers testing for the frequent causes of PID. Our proctitis menu is designed for patients with clinical concerns for proctitis. The accepted collection site for this menu is a rectal swab. The complicated genitourinary menu tests for a wide array of pathogens that cause GU infections. This panel can be helpful in determining the cause of complex, atypical genitourinary symptoms, such as when there is a clinical suspicion of aerobic vaginitis. Finally, we offer a CGT asymptomatic menu for asymptomatic patients with high-risk behavior or recent exposure to an STI. This menu tests for chlamydia, gonorrhea, and trichomonas. There are multiple accepted collection sites for this menu, and the specimen should be selected by the suspected route of transmission.